Here's something surprising. Certain fruits might actually accelerate aging, negatively impact brain health, and elevate blood sugar levels more dramatically than soft drinks. According to research published in the Journal of Clinical Nutrition 2023, individuals over 65 who consumed specific high-sugar fruits regularly showed a 57% greater likelihood of developing metabolic syndrome, a condition associated with increased stroke, diabetes, and heart failure risk. The concerning reality? These same fruits are often promoted as healthy or digestive aids, yet they could be silently harming your body day after day. For those over 65, your metabolism has naturally slowed, cellular vulnerability has increased, and sugar tolerance has diminished significantly, meaning improper fruit choices can rapidly cause genuine harm. On a more positive note, certain fruits function like natural medicine for older adults. They can reduce blood pressure, enhance cardiac function, and even support cognitive health that outperforms your chronological age. In this video, we'll explore 4 fruits seniors should incorporate daily and 4 they should strictly avoid. Pay special attention to the final fruit on our caution list. It's sweet, juicy, widely consumed, but potentially depleting your vitality and reducing your longevity. Before we begin, please share your location in the comments section below. And remember to like this video and subscribe to our channel for similar content. Now, let's begin. Number 4. Avocados. Avocado, technically classified as a fruit, earns its place on this list for compelling reasons. Unlike outdated nutritional guidance that recommended avoiding all fats, avocados represent one of the most advantageous foods seniors can include in their dietary regimen. What distinguishes avocados is their abundant monounsaturated fat content, particularly oleic acid, which research demonstrates can effectively lower harmful LDL cholesterol while enhancing beneficial HDL levels. This specific fat composition makes avocados particularly valuable for seniors managing cardiovascular health, as improved cholesterol ratios directly correlate with reduced heart attack and stroke risk. That's merely the beginning. Many seniors aren't aware that avocados contain higher potassium levels than bananas, approximately 975 milligrams per fruit, making them exceptional for blood pressure management, especially significant since hypertension affects nearly 2/3 of adults over 65. Avocado potassium functions by offsetting sodium intake and relaxing blood vessel walls, naturally bringing blood pressure measurements into healthier ranges without additional medications. Beyond heart health benefits, avocados deliver substantial lutein, an antioxidant carotenoid shown to enhance eye health and slow progression of age-related macular degeneration, a primary cause of vision deterioration among seniors. Perhaps the most underappreciated avocado benefit is how effectively they support nutrient absorption. Many vegetable-derived vitamins and antioxidants, including vitamins D, E, and K, are fat-soluble, meaning your body requires fat for proper absorption. Consuming avocado alongside salad or cooked greens can increase absorption of these crucial nutrients up to 15-fold. That's a substantial advantage for anyone seeking maximum nutritional benefit without relying on numerous supplements. How can you incorporate these benefits? Just half an avocado daily is sufficient. Spread it on whole grain toast, blend it into smoothies, or enjoy it simply with a spoon and lemon squeeze. However you prefer it, this fruit genuinely transforms senior health outcomes. Number 3. Apples. Apples contain impressive fiber content, particularly pectin, which nourishes beneficial bacteria. A healthier digestive system promotes better digestion, stronger immunity, and enhanced nutrient absorption, 3 increasingly important factors as we age. What makes apples even more remarkable is their impact on cholesterol and cardiac health. Pectin binds to cholesterol within the digestive tract and facilitates its elimination from the body, effectively reducing LDL cholesterol over time. Apples also contain flavonoids like quercetin that reduce inflammation and support cardiovascular function. Their role in blood sugar regulation deserves mention too. Despite their sweetness, apples have relatively low glycemic impact, and their fiber slows sugar absorption into the bloodstream, preventing spikes and crashes. For seniors with insulin resistance or type 2 diabetes, this characteristic proves especially beneficial. Apples also provide exceptional satiety thanks to their fiber and water content, making them excellent for appetite management. Here's something less commonly known. Chewing apples stimulates saliva production, which helps reduce cavity and gum disease risk, conditions that become more prevalent with age. Whether red, green, or yellow, apples represent one of the most accessible and versatile fruits, and incorporating just one daily can support virtually every major bodily system. Number 2. Pomegranate. While pomegranate might not immediately come to mind as a daily snack option, for seniors, this ruby-colored fruit provides extraordinary heart benefits. As we age, arteries naturally begin to stiffen, potentially reducing blood flow, raising blood pressure, and increasing cardiac strain. What distinguishes pomegranate is its rich supply of pinocollagens, antioxidants so potent they can reduce arterial oxidative stress by over 30%, according to research published in the journal Atherosclerosis. Studies indicate that pinocollagens may exhibit up to 3 times the antioxidant activity of red wine or green tea. When oxidative stress accumulates, it causes arterial wall inflammation and narrowing, similar to corrosion in aging plumbing. Pinocollagens help clear these issues, promoting smoother, easier blood flow. Additionally, pomegranate juice has demonstrated ability to lower systolic blood pressure by 5 to 21% in hypertensive individuals, significant for seniors seeking to manage blood pressure without increasing medication. The benefits extend further. Pomegranate also enhances memory and cognitive function. In one UCLA study, older adults consuming pomegranate juice daily demonstrated significant verbal memory improvement compared to non-consumers. This finding is crucial since memory decline represents one of the most feared aspects of aging. For those with dental concerns, pomegranate juice offers most of the same benefits without requiring chewing. Even concentrated antioxidant supplements have shown promising results, though whole fruit consumption provides additional fiber and micronutrients. Importantly, you don't need daily consumption of full servings. Even incorporating half a cup of seeds or adding a small amount of juice to your morning smoothie can deliver substantial benefits. Unlike many sugary fruits, pomegranate has low glycemic impact, meaning it won't cause dramatic blood sugar fluctuations, ideal for seniors with prediabetes or type 2 diabetes. Ensure you select 100% pure pomegranate juice without added sugars. If you take blood thinners, consult your physician first, as pomegranate may interact with certain medications. Overall, this fruit doesn't just promote health, it could potentially extend your healthy lifespan by maintaining cardiovascular youth. Number 1. Berries, blueberries, raspberries, and blackberries. Topping our list of beneficial fruits for seniors are berries, specifically blueberries, raspberries, and blackberries, which collectively offer the most impressive array of age-defying properties among all foods. What makes berries uniquely beneficial for seniors is their specific impact on cognitive function and neural health. These small fruits contain abundant anthocyanins, natural plant compounds that not only provide blueberries their vibrant color, but also function as powerful antioxidants. When consumed, these compounds reduce brain inflammation and enhance communication between neurons. Groundbreaking research published in the Annals of Neurology found that seniors consuming just 2 weekly servings of blueberries experienced measurable cognitive aging delays of up to 2.5 years. This means they essentially maintained cognitive function equivalent to someone 2.5 years younger. This neuroprotective effect appears connected to berries' unique ability to cross the blood-brain barrier and directly neutralize oxidative damage in neural tissues. The benefits extend beyond memory. Blueberries also improve balance and coordination, critically important for fall prevention, a leading cause of injury among seniors. The cardiovascular advantages of regular berry consumption are equally impressive, with multiple studies showing significant blood pressure reductions, improved arterial flexibility, and decreased inflammation markers among older adults who incorporate berries into daily diets. These effects translate to measurable heart disease risk reductions, particularly important since heart disease remains the leading mortality cause among seniors. Beyond these major benefits, berries offer exceptional blood sugar management properties, with fiber and bioactive compounds helping stabilize post-meal glucose levels, preventing dangerous blood sugar spikes that can worsen diabetes or pre-diabetic conditions common in older adults. The fiber content in berries, approximately 8 grams per cup, also supports digestive health and promotes regular bowel function without irritating sensitive digestive systems. Just 1 daily cup added to oatmeal, yogurt, or smoothies can create noticeable differences in energy, focus, and even mood. Choose fresh or frozen berries. Avoid dried varieties, which often contain added sugars that counteract the health benefits. Having explored the top 4 fruits seniors should definitely incorporate, let's examine the 4 fruits seniors should strictly avoid, beginning with one that might already be in your kitchen. Number 4. Grapes. Initially, grapes appear harmless and potentially beneficial. They're small, sweet, refreshing, and often promoted for their antioxidant content, especially darker varieties. However, for seniors, grapes can be deceptive. A primary concern is their extremely high sugar content combined with minimal fiber. Grapes contain glucose-fructose sugars, and because they're so easily consumed by the handful, it's remarkably simple to ingest far more sugar than intended. Just 1 cup of grapes contains approximately 23 grams of sugar, comparable to a small candy bar. For older adults potentially managing blood sugar issues, this can create significant problems. The fiber deficiency means sugar rapidly enters the bloodstream, causing blood glucose and insulin spikes. These fluctuations aren't merely temporary, they're associated with weight gain, inflammation, and increased type 2 diabetes risk. Additionally, non-organic grapes often carry pesticide residues, and seniors with compromised immune systems or sensitive digestion may be more vulnerable to these chemicals. Even grape skin, though thin and easily chewed, offers minimal nutritional value compared to apple or pear skin. The conclusion: while grapes may seem innocuous, they represent a hidden blood sugar challenge, particularly dangerous for seniors maintaining stable energy, weight, and metabolic health. Number 3. Dried fruits. Dried fruits, particularly commercially processed varieties containing sulfites, represent one of the most problematic fruit choices for seniors, despite their seemingly wholesome nature and convenience. The most immediate concern with dried fruits involves their extraordinarily concentrated sugar content. When water is removed during drying, what remains is essentially fruit sugar in highly concentrated form. A small handful of dried apricots contains approximately the same sugar amount as several whole fresh apricots, making it extremely easy to consume excessive fructose without the fiber and water that normally provide satiety signals. This sugar concentration is particularly hazardous for seniors managing diabetes or insulin resistance, as it can cause dramatic blood glucose spikes even in small quantities. Over time, this can lead to type 2 diabetes or complicate existing diabetes management. The issues extend further. These sugar spikes also increase bodily inflammation, potentially worsening arthritis pain, accelerating cognitive decline, and even compromising immune function, which seniors cannot afford to risk. Additionally, commercially produced dried fruits frequently contain added sulfites, preservative chemicals used to maintain color and extend shelf life. These sulfites can trigger severe asthmatic reactions in sensitive individuals, with seniors being particularly vulnerable due to age-related respiratory changes and increased prevalence of asthma and COPD. Approximately 1 in 100 people have sulfite sensitivity, but this percentage increases significantly among seniors with respiratory conditions. The inflammatory potential of both concentrated sugars and chemical preservatives in dried fruits makes them particularly inappropriate for seniors managing inflammatory conditions like arthritis, which affects nearly 50% of adults over 65. Number 2. Unripe bananas. While ripe bananas with brown spots can benefit many seniors, unripe or green bananas present several significant health concerns that make them among the worst fruit choices for older adults. The primary issue with unripe bananas involves their high resistant starch content. Unlike easily digestible sugars in ripe bananas, this starch resists small intestine digestion. For seniors already experiencing age-related digestive changes, such as decreased enzyme production and slower gut motility, this resistant starch can cause significant gastrointestinal distress, including bloating, gas, and abdominal discomfort. The problem worsens in seniors with irritable bowel syndrome or inflammatory bowel conditions, which become increasingly common with age. Difficulty digesting unripe bananas extends beyond discomfort. It can impair nutrient absorption from other foods consumed during the same meal. This is particularly problematic for seniors who may already experience nutrient deficiencies due to medication interactions, reduced appetite, or age-related changes in absorption efficiency. Furthermore, the astringent compounds in unripe bananas, responsible for their characteristic chalky texture, can irritate sensitive digestive tract linings, triggering inflammatory gut responses. From a nutritional perspective, unripe bananas contain significantly lower antioxidant levels compared to ripe counterparts, as these beneficial compounds increase dramatically during ripening. For seniors seeking anti-inflammatory benefits from fruit consumption, this reduced antioxidant content makes unripe bananas a particularly poor choice. Number 1. Grapefruit. Topping our list of fruits seniors should avoid is one that might surprise many: grapefruit. Despite its reputation as a health food and weight management aid, grapefruit poses potentially life-threatening risks for seniors taking certain medications. The danger lies in compounds called furanocoumarins, which inhibit intestinal CYP3A4 enzyme production. This enzyme metabolizes approximately 85 different medications. When inhibited, medications can reach dangerously high bloodstream levels. It's equivalent to receiving a much higher dose than prescribed, despite taking the correct amount. This can dramatically increase side effect risks, some potentially serious or even life-threatening, depending on the medication. The affected medication list is extensive and includes many commonly prescribed to seniors, such as certain cholesterol-lowering statins, including atorvastatin, lovastatin, simvastatin. Some blood pressure medications, particularly calcium channel blockers like nifedipine, anti-anxiety medications like buspirone, anti-arrhythmia drugs like amiodarone, even certain antihistamines and immunosuppressants. For example, consuming grapefruit while taking Lipitor can increase drug concentration by over 400%, dramatically raising serious side effect risks, including muscle breakdown and kidney failure. More alarming still, these interactions don't require large grapefruit amounts. Even half a fruit or a small juice glass can trigger dangerous interactions. Effects can persist up to 72 hours after consumption, so simply spacing medication and grapefruit intake doesn't resolve the issue. Because the interaction potential is so significant and involves many common medications, vital for managing senior health conditions, grapefruit tops our list of fruits to avoid or approach with extreme caution. If you take any prescription medication, it's absolutely essential to consult your doctor or pharmacist specifically about grapefruit or grapefruit juice safety. Never assume it's acceptable. The risk of amplifying medication effects or side effects is simply too significant to disregard. It's a seemingly innocent fruit with hidden, potentially dangerous interaction potential. Conclusion. There you have it. The complete breakdown of fruits seniors should incorporate and those they should avoid. Beneficial options like avocado, apples, pomegranates, and berries can literally help slow aging, enhance cognition, and increase vitality. Conversely, problematic choices like grapefruit, dried fruits, unripe bananas, and seemingly innocent grapes can quietly drain energy, spike blood sugar, and increase inflammation that compromises health. The concerning aspect is how subtle these effects can be. Most people remain unaware that a handful of grapes or an unripe banana might trigger a cascade of internal issues until symptoms emerge. Choose wisely, eat mindfully, and whenever possible, pair fruits with protein or healthy fat. We'd love to hear from you. Have you been consuming any of these problematic fruits without knowing the risks? Which one surprised you most? Have you ever experienced unexpected reactions after eating certain fruits? Share your experiences and thoughts in the comments below. Thanks for watching.